Welcome back, everyone. We've already seen how crowded the space behind the clavicle is, so today we're moving slightly lateral to explore the shoulder's main entryway. If you're planning on a career in orthopedics or general surgery, this next region is your bread and butter. We're talking about the deltopectoral groove, your primary surgical corridor, and the coracoid process, which acts as the lighthouse for the entire shoulder. Let's get into the anatomy you'll actually need when you're standing at the scrub sink. Section 1. The deltopectoral groove. Think of this as your surgical highway. It's the natural valley between the deltoid muscle and the pectoralis major. The landmark, running right through this groove, is the cephalic vein. In the OR, this is your primary guide. Identify the vein, and you've found your correct surgical plane. The danger zone. If you're performing an incision that starts below the sternoclavicular joint and moves into this groove, the thoracoacromial artery is the structure most likely to be affected or injured. The safe zone. You can breathe a bit easier regarding deeper structures during this approach. The shoulder joint capsule, the roots and trunks of the brachial plexus, and the insertion of the pectoralis minor are all considered safe. Section 2. The coracoid process. This is the bony beak of the scapula. It's a critical anchor point for both stability and movement. Surface marking. To find it on a patient, go about 1 centimeters below a point between the medial 3-4 and lateral 1-4 of the clavicle. The hub of attachments. This process is a busy junction for both power and stability. Ligaments. It anchors the coracoclavicular, coracohumeral, and coracoacromial ligaments. Muscles. This is a classic MRCS favorite. Remember the direction of the pull. Pectoralis minor inserts here. On the other hand, it gives origin to 2 muscles which are coracobrachialis and the short head of the biceps. Remember, it is the short head. Just remember, find the vein to stay in the groove. Watch the artery during your approach and use that coracoid as your landmark for those 3 muscles. That concludes this lesson. Now, up to the next one.